Dina, can you read 5D into the record?
A resolution recognizing April 4th to April 10th as National Public Health Week.
Yep, good. And I'll turn this over then to Council Member from District 1, Dave Donaldson.
Thank you, Mr. President. Susan, would you like to come up to the podium? And as the appointed council member to the Board of Health, it's my honor to read this resolution. So, a resolution recognizing April 4th to April 10th as National Public Health Week. Whereas the week of April 4th to the 10th, 2022 is National Public Health Week. And whereas the theme for National Public Health Week 2022 is Public Health is Where You Are, and the places where residents live, work, learn, play, and worship impact community and individual health. Whereas public health professionals help make communities healthier, stronger, and safer by working to make it easier for residents to access the public health resources they need to achieve the highest level of health. Whereas the mission of El Paso County Public Health is to promote and protect public health and environmental quality across El Paso County through people, prevention, and partnerships. And whereas the vision of El Paso County Public Health is for all El Paso County residents to live in communities where every person has the opportunity to achieve optimal health. Only two more whereases. And whereas El Paso County Public Health promotes resiliency, community connectedness, and health to assure the well-being of all our populations and communities. And whereas El Paso County Public Health works to build safe, healthy communities by developing policy and collaborating with multi-sector partners across the county to assure health is a priority in our communities. And now, therefore, be it resolved by the City Council of the City of Colorado Springs that April 4th through 10th is recognized as National Public Health Week, and it is more important than ever to observe this week by helping our families, friends, neighbors, coworkers, and leaders to better understand the value of public health and to celebrate, support, and advance the work of public health in the light of this year's theme, Public Health is Where You Are. Dated at Colorado Springs, Colorado, this 22nd day of March 2022, Council President Tom Strand.
Thank you, Councilmember Donaldson. And Susan Whelan, thank you so much for being here with part of your team that you brought. And what we'll do is we'll get a motion to approve this resolution, and then we'll let you make some statements to the public. And we're sure glad you could join us today. Can I get a motion?
Move to approve.
Thank you very much, Ms. Avila. We got a motion to approve the resolution recognizing April 4th to the 10th as National Public Health Week. Can I get a second?
Second.
Okay, Nancy has seconded. Any discussion right now up at council? Seeing none, all in favor. Do you have some discussion? Wayne, did you want to say something?
Yeah, I did actually, if that's okay. And I know we've got a lot of resolutions, and I apologize for the input, but when I first became a commissioner and had some responsibility for this public health department, there weren't many people who actually knew what a public health department did. It had been, I don't know, 80 years since a pandemic of this magnitude. And there were a lot of folks that did not recognize the importance of that. I think that is no longer the case. And I am so appreciative of the work you, Susan, and your group has done, the phenomenal work that we have done in public health in our community. And so just thank you. I know the resolution says that, but I just wanted to say how much I appreciate the work that you all have done. I know that not everyone has always been happy with exactly everything that was happening. There were some on each side of that. But you have navigated it. Your group has done a phenomenal job, and I just appreciate it. So thank you.
Thank you, Mr. Williams. Ms. Henjum?
Everything that he just said, Susan, and I'm curious, COVID is, taking all kinds of interesting turns, but in addition to COVID, can you just name maybe the top 2 or 3 other public health concerns that you all are addressing right now?
And you can do that in your comments.
Okay.
That'd be great. So I want to introduce Susan Whelan, Director of El Paso County Public Health and part of her team. Did you have something, Yolanda? Sure.
I had the privilege of being on the board with our director, Susan Whelan, and I just appreciate you and your team so much, Susan. I still remember Steve and Fadi, the dynamic duo, a team that you created. You've been a target for so much abuse during these past 2 years, and it's not been warranted. You've done such great work, and I think people forget about the work that was done on hepatitis A, that was done on suicide. So much how there's clinics provided for women and infants, and to make sure that they stay healthy and robust. I had to talk about this, and Susan also received the Spirit of the Springs Award. The whole public health department did, but she was leading the charge on that. I miss you so much, and you've done such a wonderful job, and you've just maintained your professionalism and your posture, and I'm so appreciative. Thank you, Susan.
Thank you, Councilwoman Avila and Councilwoman Fortune.
I remember early on in the pandemic, as I worked for UCCS, when Susan Whelan called me, and she was far ahead of her time in this. A week into it, she called and said, and this was late on a Friday night, Stephanie, I'm worried. I'm very concerned about the mental health of people, about what this pandemic is going to do to them. What can we do? By 10:30 the next morning, we had 5 people assembled to create the GRIT program that helped build resiliency throughout the community as the pandemic continued to rage. And so, Susan, thank you for that leadership, and to your team, because I know you're as good as you are because they help you be that great. So thank you.
Great. So we've got a motion and a second recognizing April 4th to the 10th as National Public Health Week. All in favor say aye.
Aye.
Any opposed say nay. Passes unanimously. And Susan, over to you now.
Okay. Thank you very much. I really appreciate the invitation and us having the opportunity to be here. I want to introduce some members of my team first. We have Heather Graves. She is the Community Health Division Director. And we have Monica Sadowski, who is a public health nurse, and Christy Durbin, who is a public health nurse, and she is the program manager for immunization and travel clinic. We do a lot of travel immunizations for our community. We also have Kat McGarvey, who is with our environmental health services division and focuses a lot on on-site wastewater systems, which with all of the growth, we usually exceed other counties and in some of our on-site wastewater systems, especially in Northeast and the northern areas. We also have Lisa Gable, who is here with our vital stats, birth and death certificates. And so I'm happy to have them. And I also want to say that a major important support function that goes through every organization that I don't think gets recognized often is communication. And I have my public information officer here, Michelle Byerly. She got married in 2021 in the pandemic. So her name used to be Hewitt, Michelle Hewitt, but it's Byerly. She's married to a county sheriff deputy. So these are members of my team, and oh, and Vicki Bennett, our administration manager as well. She's here with us today. So, I mean, the past couple of years have really been extremely challenging and extremely difficult. What dawned on me when we were being recognized, I think it was last week, as some women with as Pikes Peak women and heroism of the pandemic, is that, you know, our agency didn't stop when there were so many challenges and there, you know, people were at home. I mean, we're working from the time that we hit the ground to the time that we were going to bed and keeping things moving in a dynamic environment. And I want to say with great appreciation and gratitude, your collaboration and your leadership. We couldn't have done it without you. And I don't see Mayor Southers here, but he was, okay, he was someone that worked alongside me, and he attended all of the meetings, and he was really there and so responsive, and also Jeff Gring and so many members of your staff. We couldn't have gotten through our community with what we were challenging us in a dynamic environment. And so I truly want to say how much I appreciate your support and on any issue as well. And I also just wanted to acknowledge some former Board of Health members here. Tom Strand has been a Board of Health member. Miss Sally Clark has been a board member, and I don't know if she's here anymore. Oh, there's a second. See you. And Mr. Dave Donaldson, then also Yolanda Avila. And so we've had a lot of support from the city and a lot of engagement. And Yolanda, I miss you too. But we still work together whether you're on the Board of Health or not, and we greatly appreciate the support. I do want to say that we are your health department, the city of Colorado Springs. There are 8 towns and cities in the county, and we have the most populous county in the state of Colorado, and there are numerous health challenges. And our agency, our public servants, I see us in the same realm as public safety. You need a strong public health department for safety as well. And we have tremendous collaborations that produce results for the public, and we will continue to do so. I also wanted to point out that I've been with public health for over 20 years, and I appreciated City Councilman Wayne Williams' support when West Nile virus emerged in 2003. And, one of the things that he had commended us on in the past was we had one of the lowest infection rates along the Front Range when you compare us to different counties. And as a testament to my agency and my team, because they are hard workers, they are dedicated, they have integrity, they have service excellence, they collaborate, they are innovative, they are data-driven, and they are respectful. But when the numbers show also, you can see the results, and everything will be evaluated on everything that we work on. But my agency produces results, and they also are compassionate. So Nancy, Councilwoman Nancy Hinman, you had asked us, what's other than COVID? There is so much more that our agency does than infectious disease focus, which we focus on infectious diseases, and there's over 60 different reportable diseases. So those diseases don't stop with COVID. However, we have a community health improvement plan, which is not the health department's, it's the community's plan. And over 60 different agencies have contributed their input, and we take information, data-driven, that is from community health indicators. We look at that, and our top 2 concerns in El Paso County are healthy eating and healthy living, and also substance use and misuse. So when we talk about fentanyl and we talk about substance use, those are our top concerns, and then mental health as well. And so when we talk about suicide and teen suicide, we have a lot of other focuses, and my team, they might not make the news all the time or what we're working on, but we do so much more than infectious disease. I also see a lot of people here that I haven't seen for a while, and I've video conferenced or on the phone. And another person I do want to acknowledge is that when we talk about public health's theme as health is where you are, and how we all contribute regardless of what our roles are, I want to acknowledge Mary Shin with the Gazette. Mary, I do, because when we talk about being, let's see, someone.
Say bad things about us, it's okay.
You have been with us through the last, 2 years and in communication with us multiple times. But I want to say when, Mr. Williams said, maybe, certain times or Yolanda Vila that, we've been a target or maybe fair or unfairly. You've been with us through it. And I know that you've had some low days and some high days because we don't take this stuff lightly. When people are sick and in the hospital and when deaths are experienced, it touches us all, our entire community. And I just wanted to acknowledge her because whether we know it or not, we've all been traumatized in some way or another at these past 2 years. And we all really appreciate kindness, collaboration, and working together. And I just wanted to acknowledge you because I know it's been tough on you and the media, and COVID has dominated the headlines. But 2022 is going to be an adjustment year, and we're looking forward to getting back to other public health business. And so thank you so much for acknowledging my public health team, because we greatly appreciate it, and we look forward to the future.
Thank you, Susan Whelan. We'll do a photograph and Dave will come down. And Susan, I did want to mention also Richard Scorman.
Yes,
Was on your board. So
Yes.
we've had a lot of us
Okay.
on there. So
Okay. And we still keep in touch.
good. Middle here. Okay. Thank you, ladies.
Find my little niche.
Yeah.
where the heads.
Yeah, we're in the middle now.
Yeah, there you go. And he raises the camera up, so I'm sure we get a better
Yeah.
exposure angle.
Okay. Jesse and Alex, thank you, ladies. Uh-oh, we're going to the expensive camera.
Yeah.
Thank you very much.
Awful bright.
Yeah. Thank you.